Good afternoon, class. This is Shelby Edwards, your physician assistant instructor for the day. In preparation for your upcoming surgery OSCE, you're going to need to demonstrate the skill of surgical scrubbing. This is what we're going to practice today. Some objectives for this lecture. I'd like you to be able to describe the importance of infection prevention in the practice of surgery. I'd like you to be able to list the steps involved in a surgical scrub, and then demonstrate the skill of the surgical scrub, which you're going to need to perform correctly at your OSCE next week. Surgery has always been a somewhat grisly business, but prior to some major medical advances in the 19th century, it was even grislier. Death from common procedures such as amputations and open fractures was as high as 50%. Surgical penetration into a body cavity resulted in near 100% death and was thus considered impossible. These deaths were because patients developed infection afterwards. In 1846, Henry Bigelow published the use of anesthesia, making larger and longer surgeries possible. In 1847, Semmelweis noted that maternal death could be reduced if obstetricians washed their hands prior to delivery. In 1867, Joseph Lister published his Sentinel articles on aseptic technique. In 1865, Louis Pasteur described the putrefaction of tissue as being attributable to microbes. In that same year, authorities outside of London decided to treat sewage by using carbolic acid. They discovered that it saved the lives of both humans and cattle. Based on these accounts, Joseph Lister, the rather severe-looking gentleman in the picture, decided to clean his surgical instruments with carbolic acid prior to using them. Lister based this practice on Pasteur's work, making the leap that these microbes were causing the postoperative infections that were killing half of his surgical patients. The timeline published on the slide reveals that his death rates went from almost 50% down to 5% by 1877 with the implementation of his technique. 2 days prior to his coronation, King Edward publicly thanked Lister for performing an appendectomy that saved his life. Prior to the advent of aseptic technique, it would have killed him. What we know today is that Louis Pasteur was right, as was Lister with his clean instruments and Semmelweis with his clean hands. These save lives, prevent infection, and make surgery as we know it today possible. Surgery is performed today in as microbe-free an environment as possible, and we go to great lengths to prevent infection. Before putting on gown and gloves, a 2 or 5-minute hand wash, known as the surgical scrub, is performed. After this, we put on gown and gloves, which provide a sterile barrier through which we can operate on the patient. In addition, the patient's skin is cleaned or prepped with a chemical solution, also to reduce its microbial content. Any instruments used in the surgical procedure have been carefully sterilized in an autoclave. In the 1-minute paper, I'd like you to write down everything you can think of in the following 2 categories: why surgical wound infections are a bad thing, and what we can do in the hospital to prevent them. So right now, take just 60 seconds and write down everything you can think of. Good work on that, class. What you came up with is that surgical wound infections are bad because patients can die. They require longer hospital stays, they're very expensive, they increase morbidity in addition to mortality, and may require additional procedures to eradicate the infection. So what can we do in the hospital to prevent the infections? Hand washing is certainly at the top of that list. We practice meticulous sterile techniques, In addition, we're vigilant for breaks in aseptic technique and vocal about them when we see them. We practice universal precautions which protects both ourselves and our patients, as well as we're aware of contact or droplet precautions which can be spread around the hospital, such as methicillin-resistant Staphylococcus aureus, tuberculosis, vancomycin-resistant Enterococcus, and influenza virus, among others. Additionally, we give patients a dose of antibiotics before surgery. All of the things that you mentioned in your 60-second paper are extremely important. Surgery is one of the riskiest reasons to go to the hospital, as surgical patients have some of the highest complication rates. Infection is very much worth preventing for keeping our patients healthy and safe in the perioperative period and for keeping healthcare costs down. It's also of note that hospital accreditation requires hospitals to report their infection rates. To maintain accreditation status, the Joint Commission records these infection rates among their key events. JACO reports that 2 million hospitalized patients get an infection each year, and that 90,000 or 4.5% of these patients will die because of their infection. Next, we're going to watch a short video. Upon entering the operating room, you need to remove any lab coat which you have been wearing inside of the hospital and change into your scrubs. Additionally, at the front doors, you will need to find a hair covering. Put on your hat so that no hair is visible underneath it. Additionally, any shoes that you have been wearing should be covered with shoe coverings or booties, also located at the front doors. Once in your hat, shoe covering, and your scrubs, you're now ready to enter the operating room. In order to reduce the number of microbes that we bring from the outside environment into the operating room arena, we need to remember to take our lab coat off, change into clean surgical scrubs. Surgical scrubs should never be worn outside of the hospital. Additionally, please make sure all hair is covered with a hat, and booties cover your outside shoes. All right, if you haven't gotten them already, we're going to practice scrubbing. I'd like you to get a kitchen sponge with both a soft and a scrubbing side, a toothpick, and if you have access to one, a deep sink. If you don't have access to a deep sink, you can position any object about chest height and use your imagination that it is a faucet, and this should suffice. If you need, pause the video and get these items since we're going to practice. Once you get to your individual operating room, you're going to want to don a mask. As you can see, this mask comes with a plastic splash shield to protect your eyes from any droplets you may encounter during surgery. Be sure to squeeze the nose. Then you're going to pick out the scrub brush that you like and turn on the water. Note the time that you begin your scrub. Inside of the packet, you'll find the scrub brush with a soft and a bristly side, as well as the little pick that you will use on your fingernails. Under actively running water, you're going to start by cleaning out your fingernails with the pick. Each individual fingernail, you want to clean any debris from underneath it under actively running water. After using the fingernail pick, you should discard it, and you want to start scrubbing with the bristly side of the brush, again working on your fingernails. Do one hand and then the other hand. After cleaning your fingernails, you're going to clean the palms of your surfaces, also usually with the bristly side of the brush. Make sure you get all sides, and then you're going to switch to the soft side of the brush and do any remaining surfaces of your hands, such as the dorsal side of your hands. Again, make sure you carefully clean each surface Do one hand and then your other hand. Then you're going to want to work on each individual finger, all 10 fingers, first from one hand, then the other hand. Make sure all fingers have been lathered up nicely. Then you're going to rinse each hand under the running water. After rinsing your hands, you're going to start cleaning your forearms all the way up to your elbows. Lather each surface of your forearm. First one forearm, then the other forearm. When both of your forearms are completely lathered and covered with soap, up to the elbows, you're going to discard your brush and then you're going to rinse. Carefully rinsing so that the hands are held higher than your elbows so that any water droplets are not running down your arms, but instead towards your elbows and the areas that you have not scrubbed. Now you're scrubbed, and it took 5 minutes. To review, the first scrub of the day should be 5 minutes in length. Any subsequent scrubs on the same day are then abbreviated to 2 minutes in length. Steps to the surgical scrub are as follows. Clean your fingernails first with the fingernail pick under running water. Then use the bristly side of the brush to clean your nails and both palms. Next, switching to the soft side of the brush, clean the dorsal surfaces of your hands and make sure that all sides of your hand have been covered. Then you want to clean all sides of each individual finger. Once your hands are all cleaned and you've worked up a good lather, you're ready to rinse your hands. After rinsing, you're ready to scrub your forearms. Scrub all surfaces of each forearm, ensuring you have not missed any areas from your wrists up to your elbows. Next, you're going to rinse your forearms, carefully ensuring your hands are held higher than your elbows so water does not drip. This is important since as healthcare providers, we're essentially overly large fomites for disease and microbe transmission. Since we see many patients in a hospital, once we touch them, we are both picking up microbes and depositing our own. To reduce the transmission of microbes, we wash our hands before and after touching any patient. Prior to operating on a patient, we perform a long hand wash, such as we've just practiced, known as a surgical scrub. This reduces infection. So, the take-home students, practice, practice, practice. You'll need to have excellent technique in performing the surgical scrub to perform well at your OSCE next week. I would suggest writing the steps out, memorizing them, and then repeatedly putting them into practice. As long as you spend some time making sure that your technique is good before the OSCE next week, you should perform well. Good luck, and I'll see you next week at your OSCE.